Welcome back to Wisconsin, family. We are here at Dentistry for Madison on West Wash. We are joined again, thankfully, by Dr. Jay Hazen. Dr. Jay,
how's it going, guys?
Thanks for letting us come and crash the party.
Oh, I love you being here.
Yeah.
Thank you.
So you keep on giving us lots of information about mouth health and everything like that. So if you could kind of dive in a little bit, what are the differences between gingivitis and periodontist? Did I pronounce that correct?
Periodontitis.
Periodontitis.
Yes.
I missed a syllable.
Oh, that's all right. Which just means inflammation. So where it is, gingivitis would be inflammation of the gum tissue and the supporting tissues of the teeth. Periodontitis would be inflammation of the supporting tissues, including bone, around the teeth. So there are different stages. Gingivitis can become periodontitis if left uncorrected or undiagnosed. So a lot of times the difference is just the severity of really the same disease and the same bacteria.
Makes sense.
Interesting. And so obviously there's different levels of severity, as you talked about. So it's very possible that someone might have a very mild case of one of these. I mean, do you come across that where people have a mild case of some kind of gum disease and they don't even realize they have it?
Absolutely. I mean, you know, there are oftentimes people come in and they think they're doing a great job, and we point out maybe not areas where they have gingivitis or gum problems.
Janet, why are you looking guilty?
Yeah.
Yeah, it might just be isolated areas.
Yeah.
So, you know, there might be an area where they're routinely missing, taken care of, and you know, the rest of your mouth doesn't make up for areas that are being missed. Right. You need to do that. So sometimes our hygienists or we, as the doctors here, might take a look and say, hey, you got to work a little bit more in this area, or you're missing this spot, and you know, so on and so forth. So a lot of them are fine-tuning things, and some, you know, some people are very surprised if we tell them they do have something that's been going on for a while that maybe they had no idea about.
That's really interesting, because I know I'm a super regular with my diligent oral health care, but maybe I'm missing a spot every day.
Yeah, right. Well, we get in a routine. We do everything the same way,
right?
You know.
Let's talk about some of the signs, the symptoms that we might notice.
Well, I think the first sign that alarms all of us when something's going on is, you know, if your gums are bleeding when
That's
you're
not
flossing
normal.
and brushing. No. I mean, if you rub the back of your hand and it started to bleed, would you consider that odd?
Good point.
So I would.
That's not normal?
No. Mine doesn't do that, but I don't know. You know. But at any rate, you know, if some things don't seem right, bleeding is not normal for your gums.
Right.
And people say, oh, my gums have always bled. Well,
Wow.
maybe they have a low-grade inflammation that could, you know, go on to what we talked about earlier, some serious periodontitis, which can cause actual tooth loss. So our goals are to identify these things and stop this in its tracks. And we can do that. It's one of the few things that a patient can help improve, along with some things that we can do, but a lot of times patients can help themselves.
Yeah.
Okay, so with the start of that, with gingivitis, then what are some of the things that either can cause that, things that we can prevent? Get into that a little bit for us.
Well, you know, most of it is good hygiene, prevents gingivitis, periodontitis, getting a toothbrush around all the areas of your teeth, using floss, maybe using a mouthwash that might have xylitol or something in it that's going to be antibacterial, would help also. There's a lot of options out there, but I think the basics are making sure you're brushing for a good 2 minutes, getting all the areas. A lot of the electric toothbrushes have timers on them now. Making sure you're getting floss through there. And back to the 2 minutes, you have no idea how long 2 minutes is. You know, you think, well, that's 2 minutes, and it might be 30 seconds. So, you know, the little beeps and clicks on an electric toothbrush really do help. Not to mention their motions help. And we see a vast improvement in people's ability to keep their teeth clean when they're using something that's either sonic or rotating in nature.
Sure.
You mentioned the electric toothbrush that has the timer on it. You know, my kids actually, we recently got like a regular toothbrush for them that has these lights that light up. So it's like green, yellow, and red. So green means go, start brushing. Yellow means you're almost done, and then red means okay, you're done.
Yeah,
and I think it's
that's
about
cool.
2 minutes actually.
That's right.
So,
And if you were to just turn that thing on and look at it, you'd think it's 5 or 10 minutes.
Yeah.
2 minutes is a lot longer than you think. But again, it's just keeping things clean. So back to your question, I mean, gingivitis is a lack of removal of plaque, which causes inflammation, and the periodontitis, or the more involved stuff, comes from that progressing. So it is avoidable. We can improve things.
is this something that kids or parents should be worried about for their kids, like even before, you know, the adult teeth come in? Is this something that parents should be worried about with their kids?
You know, I think bacteria in the body and a source in the mouth, yeah, certainly. I think our kids get away with a lot, you know, prior to becoming adults, because things are changing, they're growing, and of course it's important.
Right.
But I think it's even more important when we get to the point where the last chance we have is with the teeth that we get as adults.
Right.
And you know, the reality is we're all living longer. We're all trying to keep our teeth, so they're being asked to do a lot more. And the good news is we have a lot of options to treat gum disease, and they're becoming less and less invasive and extremely effective.
So we got through Halloween, and we maybe haven't been brushing as well, and maybe there is some gingivitis or gum disease. Is it reversible?
Absolutely.
Oh, that's good news.
It's one of the few things, you know, you can change the path of health in your mouth by doing the things that you need to do. If you have a cavity in a tooth, we probably need to take charge of that and fix that for you. Whereas gingivitis is completely reversible, and we can make it better. Gum disease, on the other hand, periodontal disease, can start to create a little bit more of a problem that we need to be more aware of. Maybe more frequent cleanings to keep things under control. 6 months is a generalization, and it certainly isn't something that I think everybody fits into. Some people are better at getting their teeth cleaned every 3 months, or 4, or maybe 6.
Dr. J, what do you think, with regard to gum disease, do you feel sets you apart from a lot of the other dentists in the area?
Well, fortunately, a few years ago, I was trained in using laser to treat gum disease, and the laser is a lot less invasive than some of the surgical techniques that are out there. The laser uses energy to kill bacteria and stimulate the body to fix itself without laying a large flap or doing a lot of invasive surgery, which can in fact also create some bone loss in the effort of making things better. So I think the laser has really changed how we look at things.
Wow, that's you just hit me with something where I have a whole bunch more questions. So you're going to have to invite us back to the party.
I can do that.
All right, very good.
I'll show you, and we'll talk more about it. That'd be great.
Awesome, cool. Thank you, Dr. J. Thank you to all of our guests, and to you for joining us on Wisconsin Family. We'll see you here next time on Channel 57, our home for local.